Hi, thank you for joining us for this IEP meeting from Morgan Thomas. I first would like to introduce the team members, which include myself, Kelly Lockhart. I'm the special needs teacher, our general education teacher, Mrs. Parker, our LEA representative, Ms. Griffin, and our administrator principal, Mr. Baker. We'd also like to introduce the mom and dad, Mr. and Mrs. Thomas. And also, if we have any specialists that are included in this IEP, then they will be also introduced and given their roles too. The IEA meeting will include a few terms that you may not be familiar with. And one of them is the PWN, which is prior written notice. This is for the parents in case there have been changes that are made in the district or in the school. It is a written explanation of a change the school district wants to make or refuses to make in a child's IEP. The parents should know what the school plans to do and what the school plans not to do for the child. And they have a right to know what's going on with that. The ESY, Extended School Year, provides general information regarding extended school year. It's related services and special education that is provided for a child with a disability. It goes beyond the school year, the normal school year, in accordance with the IEP at no cost to the parent. LRE, least restrictive environment. Now, this is not a place, it's a principle that guides the child's education program. Children who have special needs will be and should be in the same classroom as other children as much as possible. So, with least restrictive environment, sometimes what this includes is a student being being inside of the special needs classroom and just being pulled out occasionally for services that have been recommended for the IEP. It could be a speech therapist, it could be an occupational therapist, it could be the psychologist, the social worker, any of those specialized occupations. So, again, we've done the introduction, and if there are any questions that Mr. and Mrs. Thomas have, we ask that you please ask them if there's any concerns or complications or anything that you need to know or understand. Please feel free to ask. At this time, the LEA representative will give the parents a copy of the procedural safeguard and brief explanations. So at this time, she will give that to the parents. Again, parents, you are welcome. We thank you for coming and attending this meeting with us. It's very important that we seek out whatever services or whatever Morgan needs in order to progress in her skill set and any other educational contents or anything that she needs in order to progress. We're going to go over the testing now that we have taken. I will give you the name of the test, the purpose of the test, and the results of the test. And this will tell us whether or not Morgan shows that she is eligible for services. If we have any specialists at the table, the specialists will also go over their test results or their observations and tell us, how Morgan did and what they think she needs. Again, we always want to make sure that the parents have the opportunity to ask questions. So after every phase in this, we will ask the question if they have any questions. Now, after that, we will discuss the present level achievements. This will be the opportunity for the mom and dad to tell us, because this is an initial IEP for Morgan, the parents will tell us and share with us some of the things that Morgan is good at, some of the things that she struggles with at home, what Morgan's dislikes or likes are, what their concerns are for at home, and just share with us some things about Morgan that we may not know about at the school. After the parents have discussed with us and told us some things that Morgan likes and dislikes or that she struggles with, then we will move on to talk about any special factors that need to be considered and discuss a best plan of action for Morgan based on the information that we have from the parents and the testing. So once we finish with that, then we will move on again to ask the parents if they have any questions pertaining to this process. We will see if the parents are concerned about any decisions that we've made or anything that they feel is important or needs to be addressed during this meeting. Now we can write some measurable IEP goals that Morgan will be working on this year. We have determined as a team that Morgan doesn't need Braille. She doesn't need assistive technology. She would definitely need some behavioral strategies and assistance with communication. So this may require one of the specialists to, again, take her out of the classroom and apply some of these assistance strategies that she may need. We will also, once we've determined the strategies that need to be applied, we will discuss the services that are needed. And this will entail how many minutes are required of the specialist to work with Morgan. So, for instance, the speech specialist may say she needs 30 minutes of speech. She may need 30 minutes of the speech specialist working with her in different areas, such as, I don't know, communication or sentence structure or asking questions, seeing what the response is, things of that nature. So, and then they'll come up with how many minutes or how long the duration of this will be and what days it would be. So this would also prepare the teacher um, to know what days that Morgan will be pulled out of the classroom. And it also may be discussed during this time that the speech therapist may give or help the teacher provide some activities um, for Morgan to work on to also help reach the goals that she may have at this time. Again, we'll pause for a minute to ask the parents if they have any questions, if they have any concerns, if they're okay with what we've decided so far. If some parents there may be some students who have health issues. The parents may be concerned about, the student having some health issues. So in that, we will decide as a team that we will bring in the nurse and the nurse can create a health care plan for Morgan. At this moment, the LEA will discuss placement because there's different options of placement that will be made based on the needs of the students. She will suggest that she may suggest she be placed in the least restrictive environment. She may suggest that she be placed in the general education classroom and still be able to be pulled out. So there's many different options that the LEA representative may give to us. This is the time also that the LEA representative will ask the parent if they have any questions in regard to what she's decided in terms of placement. And to reassure, it will be my job to reassure the parent that if we need to revisit this, if they're not happy with the results of what we've come up with, then this can be revisited and reconsidered, and we can come back and have another meeting. Once we've done that, we've come up with the test results, we've discussed the present levels, We've talked about the goals. We've talked about the services. I've given them terms of words that may be used during this IEP. And so now it's time for us to decide if this is the plan of action that we're going to go with, and a signature is needed. The signature is needed in order to be clear that the parents were present and participants of the meeting. Once this is over, we ask the parent again if they have any questions. We give them a copy, and then services will be provided for Morgan. Thank you for joining us for this meeting. If you have any questions, Mr. and Mrs. Thomas, please feel free to call us. Our numbers are on your copies of the IEPs, and feel free to call us. And if you have any questions or concerns, or you want to, revisit this again. Thank you. So, how can I get the parent actively to listen and address the needs of the families? Well, one of the things that I think is very important is that we should always be in constant communication with the parent, whether it's a couple of days before the meeting or leading up to this meeting, because the parent has to come to us to let us know that they see some concerns. And at that point, then we have to take action as the teacher of the classroom, whether it's the special needs teacher or the general ed teacher, and make sure that we meet the needs of the parents. And the way to do that is to actively listen. That means when they have a concern or they have an issue about something that they want to talk about, then they can come to us and freely discuss what concern that they have. How can we address things to our families and other stakeholders? Well, as a team, it's important for us to pay attention, make sure that we meet before they get there, and come up with a plan or come up with a strategy, even if we think that there's going to be a disagreement or a conflict during this. So it's important for us to meet as a group also. It is also important for us to be good representatives of the school district so that the parents know that we really do care about their children and that we're willing to be advocates for them and make sure that they get everything that they need for the child. So this is very important, just the communication, to make sure that we're communicating with the parents on a consistent basis.